You remember that this year, from around April, we went for the longest strike that has ever been there for clinic officers. 99 days for the county governments and for 122 days for the Ministry of Health. The end of this strike was by a return to work agreement that was midwifed by the Employment, Labor and Labor Relations Court. And the same return to work agreement was registered by the Employment and Labor Relations Court, and by that it became an order of the court. But the ministry and the county governments have not fully implemented the return to work agreement, given that the deadline for implementation was the first day of September 2024. We have done numerous letters, they have refused to respond. And so we are saying they're in breach of the return to work agreement of the year 2024. And that is why we are here today to call them to account, and by that declare that we are calling for a strike in the next 14 days.
The Kenya Union of Clinical Officers entered into a return to work agreement with the employer, that's the Ministry of Health and the county government under the Council of Governors, following 99, that's 100 days on strike last year, with the specific concerns. And all the issues raised therefore have not been fully addressed as it was provided under the return to work. The next issues on the which also was on the strike notice then was the collective bargaining agreement, which we had agreed that within 60 days of conclusion of the strike, we were actually to go back on the negotiating table and finalize our negotiation within 60 days. That has not happened. Promotion has not, and the redesignation has not happened also, which was to happen before 1st September 2024. Comprehensive medical cover, that's to mean we wanted a comprehensive medical cover for all our clinical officers who are serving under the counties and the national government. A number of counties have not provided this cover, meaning that they are exposing our members to catastrophic suffering. We also demanded confirmation of the UHC, that's the Universal Health Coverage clinical officers, into permanent and pensionable terms. To this extent, only the Ministry of Health has acted on this, and the counties still remain, this issue remain unaddressed. We also talked of converting all people who have been on contract under the county, respective county, serving more than 6 years, to be converted to permanent and pensionable, because it is illegal and has no basis to be in place, because then they are manipulating clinical officers. And we agreed that this was to be. If they were not to do that, they were to pay them according to the market rate. That has not also happened, and it forms the ground of this strike notice today.